I think summer is really, the heat is really picking up. So there are a lot of doubts around summer and the heat. There's a mother who's saying that my child sweats a lot in summer, especially on the head area. And is it okay to wash their hair daily, or will it make the scalp and hair very dry?
Child's individual requirement, you can definitely wash the head daily, because if he or she has a tendency of excessive sweating, obviously the scalp get very itchy if you don't clean it properly. Maintaining the skin clean is very important, and daily washing on some days or maybe some part of the season does not matter that much. Don't use any kind of harsh chemicals or shampoos. Shampoo alternate day and just wash the scalp daily. Frequently, they can skip the shampoo on a daily basis if they just need to just put water, so just to keep the scalp clean.
There are a lot of signs, right, that you will get to know whether the head gets itchy, whether this,
Yeah,
hair
that's what.
becomes lumpy. And I
Some
think parents can just
don't
wait for
even
those signs
some
to
kids
show up.
don't even wash for a week, which is okay if they're not feeling very itchy and it's winter season and they're mostly indoors. Winter vacations, but they're mostly not going out to play. It's okay. And then if they have short hairs, then it's also easy to wash.
Tell me about it. I have two boys, so I haven't
So
seen
what I'm
the.
saying is my youngest one has little long hair, and I keep telling her, wash them, wash them. Mama, it takes years to dry. My gosh, it takes years to dry, and it takes an hour to wash the head. I go, okay, fine. It takes an hour.
I think, and I'll just move on to the next one, which is again, I think, on path. I think parents are kind of just not sure whether they are harming in that sense, because I think summer is making people. I mean, a parent says that I'm giving bath 2 times a day because of the sweating. Is it too much for kids' skin?
No, not really. That's what, no, you have to maintain the skin barrier and keep it clean. So it's the same thing. It all depends on the need. If the child is going out, sports activity, playing, and he's very sweaty, it's very important that they come back and take a bath and then moisturize. That's it.
Hmm.
Don't overdo it. Obviously, don't overdo it. That you are at home, you're unnecessarily don't give it that because you have decided that you would go give it 2 times and then you do it. That's too much. But it's on the basis of need. If
So I'll move on to some questions which are very specific and slightly in different area now. A mother is saying, my daughter is 6 months old and keeps putting her hand in her mouth all the time. How important is hand washing at this stage, and how frequently should it be cleaned? Have seen something about not over cleansing.
Definitely. So at 6 months, putting hands into the mouth is a developmental milestone, very much normal. It should be allowed to be done. The child should be allowed to do that. You don't have to remove the hand. That's most important. And usually at 6 months, the child just barely starts sitting. He's not even crawling. The baby is not even crawling. So very less likely for the hands to get really dirty. But yes, wash the hands maybe 2, 3 times in a day. And specifically before the feeding times or after the feeding times, you can wash their hands. Relates to the hygiene hypothesis we talk about. Now, you don't have to overdo everything, because the more cleanliness you give, the more chances of allergies. And these are the basic common microflora and fauna which a child should be exposed to develop their microbiome, which is also very important to develop their immunity. Because once they're getting exposed to these germs which are there in the normal environment, that is how their immunity also develops. So you don't have to frequently sanitize them or wash them. In fact, you don't have to use any kind of sanitizer on their hands. That's very important. Washing is much, much better than using a sanitizer or wiping their hands with a tissue.
In fact, I have seen this as a new trend. And what's your take on it now that you mentioned sanitizing the hand, or using a wet tissue over washing hands, especially for babies? What's your thought?
Best is washing the hands. Okay, best is washing. You cannot, there is no doubt about it, because that's how if you really want to clean the hands, washing removes all the dirt and the allergens. When you wipe it with a tissue, you're basically putting there only. You're just wiping like this. So it is not a foolproof method, but yes, if you're out, you don't have access to water, then yes, the second best option could be a water-based wipes, not a sanitizer wipes, a water-based wipes to properly clean the hands. And third, sanitizing wipes or sanitizer should not be used on kids' hands, especially less than 2 years. It should not be, because they're always putting their hands into their mouth. So preferably avoid that.
Okay, so next question is also, I think, multi-weather, but it's saying, is it okay to use the same shampoo or soap throughout the year, or should we change the product depending on weather?
It all depends on specific requirements. Also, sometimes, as we talked about atopic children, or if a child has a very dry skin, in that case, we might need to stick to one particular product. Otherwise, also in children, for a routine use, there is usually no need to change the soap and the shampoos. Usually, if you're using a mild, baby-friendly, pH-balanced soap or shampoo, you can use the same in summers and winters, unless you have a very specific requirements. As I said, in summers, if a child has a tendency of seborrhea or a cradle cap, then you might use a specific shampoo for that purpose. But otherwise, a mild, baby-friendly, fragrance-free shampoo is something which is needed. And usually, there is no need to change it depending upon the weather in small children. I think it all changes when they go into adulthood, then depending upon the specific requirements of the scalp, curly hair or a straight hair, they keep, or the colored hair or a non-colored hair, they change the products. But
Simplistic, no, in that sense, we
yeah,
can keep it simple and
yeah,
less number of products. I also
yeah,
personally feel less
definitely.
number of products are
Yeah,
better.
definitely. But you can't keep changing things just like that. No? For no reason, you don't need to change. Unless you have some specific concerns, then obviously you would go. And
So, since you were mentioning allergies and infection, I thought I can also cover this question where a parent is asking, how can I know the itching or redness I see is something that needs medical attention?
fine rash, little bit of itching, you applied a calamine lotion, you gave cold sponges and it settles down, then it's fine. Could be a heat rash or a miliary rash. But if along with the rash, you feel that the child is very irritable, very restless, or the child is having fever along with that, along with some other symptoms which might be suggestive of any other infection, or if the rash is kind of a fluid-filled rash, yellow fluid-filled rash, and it is spreading rapidly, then yes, you need to visit a doctor to find out whether it is really an allergic rash or maybe related to some kind of infection.
And interesting you mentioned moisturization so many times because I can understand parents would have come to you with that doubt because that's one of the doubt we got. Is like in summer, my child's skin is not dry like winter. So should I still moisturize or is it okay to skip it?
No, no. I think you need to moisturize. That is very important. You just need to change the preparation. Maybe in winters you might use creams, and in summers you shift to light lotions. But moisturization is important to maintain the skin barrier, as I told you. Skin needs some kind of barrier protection and hydration, which is important. So
Dr. Deepa, one of our mothers have actually sent a question saying, my child gets frequent heat rashes during summer, especially around the neck and folds. What can I do to manage and prevent them at home?
So basically, heat rash in summers is very common otherwise because it's a combination of heat and moisture. And in children, it's all the more common because sometimes the folds get affected more. Like in a small child, if a child is chubby or they have skin folds, they are feeding, there's some trickling of the food items or trickling of the milk, and it gets missed that it is not cleaned properly. So it would collect there, it will act as a skin, it will affect the skin barrier and they will develop rash. And the heat and moisture will further worsen that rash. So to decrease that rash, number one, most important is cleanliness, maintaining the skin dry. That is very important that after feeding the baby, ensure that you tap dry all the skin folds, especially the neck fold. And while giving the bath to the child, that time also it is very important to clean the fold areas because these are the areas which usually collect more of moisture along with the dirt. So I usually recommend all my moms that when you give bath to the little ones, try to clean the neck fold, axilla fold, and the nappy area because there usually the chances of rashes are most in those areas. And apart from that, yes, in summers, try to keep the child in a cool weather, airy place. Try to go out during the hot, sunny afternoons. Loose, light colored cotton clothing, that is very important. Keep the skin clean and as well as moisturized. In summer does not mean that you don't need to moisturize. Moisturization is equally important in the summer to maintain the skin barrier. Avoiding any kind of harsh creams and soaps and chemicals on the baby skin.
So just follow up on this, Deepa. Then what about these prickly heat powders? What's your take on the prickly heat powder? Does that help?
No, no, they are not recommended for children. They should not be used for children. Now, you do have natural powders. Still, we do not recommend any kind of dry powders because they act as an inhalant also. When you dust the powder on the baby skin, it gets up into the air and baby can inhale those particles and that can go into the lungs and can act as allergens and can cause pneumonitis also. So
Who sent it to us. So that since you're an allergy specialist, what is the safest way to check for allergies in kids? Is there any way we can do a basic check at home?
look, it is very difficult as such. If you're talking about the rash, allergy rash would frequently come and go. If it is because of an infection, that would stay there till you treat that infection. With an infection, the kind of rash you would get is usually a pustular rash or maybe some kind of boil. That would take some time to go away unless you apply an antibiotic ointment or you take a basic skin care. But if it's because of an allergy, you would realize that it would come and after a few hours, it might just go away and come back again. Like usually the allergic rashes would come and go frequently. They would be very fine red rashes and they would itch a lot. But infective rashes, they have a different kind of an appearance and they would not itch that much and they would not come and they would not go away and come back so frequently. They would take some time to go away and they would need some kind of treatment.
Any thoughts, any concluding comments you would have, especially around Mother's Day, given that you have an active practice and you must be seeing what's happening, you know what's happening around summer, you know what's going on in current generation's parents' mind. So you have any broader parting thoughts on this?
You don't have to really panic about everything. Just believe in yourself.
Mm.
Be self that yes, whatever I'm doing, I'm trying to do best for my baby. That is number one. Don't doubt yourself because that's something which I see every day in my OPD that probably my milk is not enough, probably I'm not doing enough, probably this is not enough, probably I am at fault. So number one is never, never say that. You are doing your best because you have given birth to a beautiful human being. That is something which is not possible for everyone, that only you can do. So it's most important is believe in yourself that yes, you can do it. Trust yourself and never say any negative thoughts to yourself. Probably this is there, I'm not doing right, this is not enough. Feed your brain positivity that yes, I'm enough, I'm doing enough, and this is enough. And I'm doing best for my baby. That is what is very, very important. What I tell my moms in the clinic. Never doubt yourself.
I think wonderful motto, not only for Mother's Day, but such an interesting and I think wonderful thought to end this, and especially on Mother's Day, that listen to everyone, but trust yourself, make your own judgment, and do what you think is right.